Hey guys, my name is Rebecca Edwards, and today I'm going to be talking to you guys about the treatment of asthma. So if you're working with an individual who has asthma, you want to focus on four main things, and that is monitoring the lung function of that person, controlling the triggers that cause their asthma, their medications, and also educating the patient on how to comply with their written daily action plan. So majority of the time, an individual who has asthma is going to have a written daily action plan that is used to control the severity and the frequency of their asthma. And it is fit for person to person. No individual with asthma is the same. So it just depends on, again, like I said, the severity, the frequency, and the classification of that individual's asthma. So for pharmacological therapy, we're going to focus on two main types of medications. We're going to focus on bronchodilators and anti-inflammatory drugs. So our quick relief medications, this is really where the bronchodilators come into play. So we've got short-acting bronchodilators. These just work to relax the smooth muscles of the airway. For example, an albuterol inhaler, many of you may be familiar with these. This is used to, again, like I said, relax the smooth muscles of the airway. And most of the time, this is recommended for you to use first, so that if you're using something after this, your airways are relaxed and open, and it's going to get to your lungs better. So then we've got anticholinergics and methylxanthines. So these are also bronchodilators that are used to relax the smooth muscle of your airway. Next, we're going to focus on long-term control medications. So these are the anti-inflammatory drugs. These focus on just controlling the inflammation in your airways and in your lungs. So they're going to prevent the frequency and severity of your asthma. And they're also going to prevent chronic damage to your lungs. So in this category, we've got glucocorticoids, cromolyn, and leukotriene modifiers. Treatment plans for individuals with asthma are based on like a stepwise approach. So if you've got mild to intermittent asthma, you may not be prescribed a daily medication to take. You may just be prescribed a short-acting bronchodilator, such as the inhaler, to use as needed. However, if you have mild persistent asthma, you are more than likely going to be prescribed a low-dose inhaled anti-inflammatory drug, possibly along with a long-acting bronchodilator, or again a short-acting bronchodilator as needed. Same with moderate to persistent. You're going to be prescribed a medium-dose inhaled anti-inflammatory along with a long-acting bronchodilator and a short-acting bronchodilator as needed. And lastly, with severe persistent asthma, you're going to be prescribed a high-dose inhaled anti-inflammatory along with a long-acting bronchodilator and a short-acting bronchodilator as needed. So as you can see, the more severe a patient's asthma is, the higher their dose of inhaled anti-inflammatory and the more things they need, such as the long-acting bronchodilator and the short-acting bronchodilator as needed. So I've just got this picture here to just remind you guys that not all inhalers are the same. So here we've got the inhalers as I showed you guys earlier. These are metered dose inhalers. This here is a dry powder inhaler, also known as a DPI. And then I think it's important to remind everyone that not all asthma medication is inhaled substances. It can also be taken in oral form. Do we have any questions? All right, thank you guys.